Hey guys, my name's Jason Schuster. I'm a doctor of physical therapy. I own Integrated Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things, including dry needling, spinal manipulation, and nutrition. Today we're going to talk about dry needling, specifically in relation to autonomic nervous system regulation and how to do it. So by the end of this video, you guys are going to come away with the tools that you need and the understanding you need of why specifically targeting the autonomic nervous system is important with dry needling and any other medical treatment, how to do it, how it's going to optimally help your patients, and you guys are going to see huge improvements with your treatment if you just implement a couple of these simple strategies. This is not stuff that gets taught in school. It's not stuff that hardly any other dry needling instructors teach about, and it's something that really, really is vital if you want to maximally optimize the health of your patients, right? You're just not going to get the clinical outcomes that you get otherwise if you're not utilizing these techniques. The most common underlying cause of chronic disease is chronic sympathetic nervous system hyperactivity, specifically the autonomic nervous system. So this can happen from a bunch of different factors, right? It can happen from eating bad food, which is probably the most common, with a combination of lack of physical activity. However, we can mitigate these symptoms and reverse the body's autonomic nervous system dysfunction through other means, because the vast majority of humans in America, at least, you guys, they're not going to exercise and they're not going to eat well. Hopefully that's changing, and I spend a huge amount of my time talking to my patients about this. It's much easier to get them to change their nutrition than it is to start exercising, right? So exercise is the least effective form of treatment that we can do in physical therapy, right? That should basically be removed from physical therapy. And one of the things that's going to happen, you guys, with the AI and stuff right now is people are just not going to go to physical therapists so PTs can watch them exercise, right? Same with athletic trainers. It's just athletic trainers may be in a little bit of a different situation because they're working with athletes and stuff like that. However, athletes should know how to exercise already, so they don't need an athletic trainer watching them how to exercise. What they go to an athletic trainer for, and I know this because I played Division I ice hockey in college, is you go to an athletic trainer because you're injured. It's not because you don't know how to exercise or you're not exercising enough, right? Athletes exercise plenty, or they should be, right? The problem is that their nervous system is dysregulated, which is going to lead to a decrease in the amount of ATPs that our mitochondria can produce. It's going to cause energy deficiency, and it's the underlying cause of almost all chronic disease, and chronic disease also causes autonomic nervous system dysregulation and sympathetic hyperactivity. So it just becomes this nasty feedback loop that is detrimental to all aspects of health. The autonomic nervous system, as far as we understand, is like a seesaw. There's a parasympathetic side and a sympathetic side. Both sides can't go up and down, right? So as the sympathetic side goes up, the parasympathetic side gets inhibited and goes down, and vice versa. As the parasympathetic side goes up, the sympathetic side gets inhibited and that goes down. So the seesaw should be more or less balancing back and forth. We need both sides of our nervous system to be functioning. They do different jobs in our body. However, if one side, the sympathetic side, is stuck upwards, and that's basically 100% of people that have any type of mental or physical health problem, right? Apparently there are some parasympathetic dysfunctions, nocturnal enuresis or bedwetting when you're little would be one of them. So when that happens, when your bladder fills, your parasympathetics are on so hard when you're sleeping, they're up so high that the bladder filling doesn't elevate the sympathetics enough to stimulate you to wake up, so you piss the bed, right? Aside from that, it's very, very challenging to come up with any other typical parasympathetic dominant problem. So in physical therapy land, athletic training land, psychotherapy, basically all our patients are going to be presenting with chronic sympathetic hyperactivity, which means the parasympathetics are going to be chronically depressed. And this is a massive problem. So when the sympathetics become hyperactive, you get excessive concentrations of things like glutamate, epinephrine, right? And you get decreases in calming neurotransmitters and neuromodulators and other things like GABA and other stuff. And then our dopamine gets dysregulated, our serotonin gets dysregulated, our gut microbiome gets dysregulated, and all that stuff goes downhill. So the primary goal of dry needling should be to regulate the autonomic nervous system as much as we possibly can And that means depressing sympathetics and elevating parasympathetics, right? We want that seesaw to get back towards a neutral level so both sides can communicate with each other and properly modulate the body. So when the sympathetic side is stuck in hyperactivity, that's one of the things that causes a decrease in heart rate variability, which is one of the main indicators of chronic sympathetic hyperactivity, right? So that's the main method that is used to dictate or indicate what's going on with the autonomic nervous system. As far as we have figured out right now, microneurography, which uses needles, is the best way to tell, but that's more expensive, harder to use. So the vast majority of studies use heart rate variability. So this is something good to understand. If it's very, very counterintuitive, I think. So heart rate variability, you want more heart rate variability. So the more variability you have, the more balanced your autonomic nervous system is. And this is a little bit tricky to think about, but hopefully I can make it easy for you guys. So if the seesaw is leveled out more or less and it's wobbling back and forth, that gives it the ability to vary, right? It's varying to sympathetic, parasympathetic, back and forth, and each side is controlling the other. When your sympathetic nervous system is stuck in hyperactivity and one side of the seesaw is on the ground, it doesn't have any ability to bounce back and forth. It's just stuck on. So if you have less heart rate variability, that means that your autonomic nervous system typically is stuck in sympathetic hyperactivity and it doesn't have the ability to regulate itself, right? So every human being has a threshold for their sympathetic nervous system. Once the sympathetic autonomic nervous system goes over the edge of your threshold and it loses the ability to self-regulate, something specific needs to be done to bring your autonomic nervous system back to the land of self-regulation so it can start communicating with the other side. Other things that happen when the sympathetic nervous system becomes hyperactive is your intestinal motility goes down. This is one of the reasons why Ozempic is such a poison, you guys. And there's finally studies from Nature, even though I hate that magazine. They're criminals just like a lot of the other medical magazines. It's just propaganda. But they actually did come out with a study just the other day showing that over 100% increase in mental health problems with people that take Ozempic, which I predicted as soon as this drug came out. If Ozempic slows down your digestion, it's elevating the sympathetic nervous system, which depresses the parasympathetic nervous system. So if you are actually trying to improve somebody's health, cranking up one side of the autonomic nervous system is the exact opposite thing that you should do. So as far as dry needling goes, we know a decent amount about how it works, but we know much more about the overall outcome, and that's the important thing. So basically, no matter how you stick needles into people, the overall outcome is parasympathetic dominance compared to baseline, which pushes that person's nervous system in the direction that we want towards homeostasis. So for dry needling, you guys, there's a couple of ways to think about depressing sympathetics and elevating parasympathetics. So the easiest way, or one of the easier ways to depress sympathetics, is just put needles into as much pathologic tissue throughout the body as we can. It's just the overall result of needling, you guys. How it works is not necessarily important. It's just that it does work, and the outcome is parasympathetic dominance compared to baseline. So if we know that treating as much short, tight tissue as possible is a good way to depress sympathetics and elevate parasympathetics, this is one of the reasons why you want to use more needles and try to treat as much of the body every time you can. I think the easiest way to think about this, you guys, is if you just think about muscle mitochondria. So skeletal muscle cells are one of the cell types in our body that have numerous mitochondria per nuclei, and they have numerous nuclei per cell, right? So the mitochondria in the nucleus, if there's more nuclei, there's more mitochondria. So like in a skeleton, like a paraspinal muscle cell, you guys, some of our bigger muscles, we can have hundreds of mitochondria and hundreds of nuclei per muscle cell. With oxygen, with sufficient oxygen, the mitochondria produce somewhere around 36 ATPs per molecule of glucose processed. Without oxygen, they only produce 2. So that's an 18x increase in the amount of ATPs that's produced just based on the amount of oxygen that's available. And one of the most objective things we know about dry needling is it massively improves blood flow. It massively improves tissue oxygen saturation, which is going to massively improve the amount of ATPs that your mitochondria can produce. It's going to give your body the energy that it needs to respond to all the other stuff that's going on. So that's the easiest one. Treat as much pathologic tissue as you can each time you treat people. Now, this is the part that hardly anybody else teaches, and it's a big, big mistake. So if we know that if you depress sympathetics, the parasympathetics elevate. Another way to depress sympathetics is to stimulate the parasympathetics, and if you elevate the parasympathetics, the sympathetics are going to get reciprocally inhibited, right? So treating as much of the body as you can each time with needles reduces as much tissue shortening, restores as much oxygen to as many mitochondria as we can. That gives our body more energy to function. Chronic energy deficiency is one of the biggest problems that people have, right? That's why with 80% of the United States is overweight. You guys overweight, obese, or morbidly obese. Every single one of those people is living with chronic energy deficiency because their body is having to work overtime all the time, which pushes the body farther into sympathetic hyperactivity and just this big nasty snowball cycle. If you specifically target the parasympathetics, this is the highest leverage way that we have to regulate the autonomic nervous system. So as far as the parasympathetics goes, the vagus nerve is the most parasympathetic structure in the human body that we know of, right? So they just did a meta-analysis on this relatively recently, trying to estimate what percentage of parasympathetic fibers that we have are in the vagus nerve. And this one study guesstimated that 75% of all of our parasympathetic nervous fiber outside of the brain is located within the vagus nerve itself. So remember, you guys, the vagus nerve innervates the most unique structures in the body. It innervates the gut-brain axis, so the enteric nervous system and the brain connected by the vagus nerve. It innervates all of our organs. It does a huge amount of stuff. So if the sympathetics get hyperactive, the most inhibited structure in the body is going to be the most parasympathetic dominant structure in the body, which is the vagus nerve. What happens after that is the vagus nerve communication between the brain and the organs and the intestines gets fouled up. The brain stops receiving proper information from the organs, and if it's not receiving the proper information, it can't relay the corresponding regulatory information. One of the other interesting things about the vagus nerve is it's the most heavily dominant afferent nerve that we know of, right? So most nerves are relatively evenly mixed, like 50-50. They're not 50-50, but relatively evenly mixed between afferent and efferent. The vagus nerve is about 80% afferent. So about 80% of the traffic of the vagus nerve is going from the organs to the brain. So it's basically our interoceptive awareness regulator. It's telling the brain what's going on with our internal structures that are subconsciously regulated. And then the brain, if it's receiving the proper information, can respond appropriately. What happens when the sympathetics go up is the vagus nerve gets heavily inhibited. The brain stops receiving proper signals from the organs. And if it's not receiving the proper initial information, it has no chance to regulate the organs properly. So by stimulating the vagus nerve, that's our highest leverage way to stimulate the parasympathetics, which reciprocally inhibits the sympathetics and pushes the autonomic nervous system towards homeostasis.